So there are so many ways this question has been asked in all university interviews I have come across, and I have asked so many people. This question keeps popping up here and there as a problem solving question. If just a night before your final exams, you have dash 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 emergency. Now those emergency keep changing. One of the family member has a heart attack, your father is not feeling well, your best friend went through a breakup and now they are super sad, your roommate is crying and in tears, your pet is not well and they got diarrhea, and there are so many ways you can ask this question. All these questions come down to the same thing. One night before exam or just before you were going to do something, if there is a problem, how would you tackle it? In clinical scenarios, the same question applies to you were going to home, but suddenly there was a patient. Now there is a patient showing up in your clinic. How would you manage that thing? Or you were going for a very important meeting, an important visit, and suddenly there is a person showing up at your door and asking you to do something right now. You might end up missing your meeting. How would you say no to that person? So this is how this question is constructed, and this is how they want to assess you, that how do you deal with the last minute situations. The broad answer to this entire question is you are a very well organized person. You do not keep things till the last minute. So yes, night before your best friend had breakup, or your father is not feeling well, or somebody in the family is in a serious condition, or your pet has diarrhea, or they're not feeling well, whatever the reason is, if it's just one night before the exam, you already studied everything for the exam. You study way ahead of the exam. Do you study on the night before the exam? That is the first place where you might tick. If you have not completed your studies at that time, then sorry, you are not an organized person. You must have already completed all the work related to it. Now, if the person is coming and asking you for a question, this is the time when you make a decision. Yes, you will stay with your friend if they had a breakup. You would go visit your father in the hospital to make sure he's doing okay. You will take your pet to that emergency so that they are looked after, but it is all matter of a few hours. Now what will you do? You will call for support. You will ask your family members, your friends, if they can look after your parent, your pet, or your friend who just had a breakup or who's not feeling well. You will make sure that you know when to say no. If the person is just asking you a favor at that time and it's your exam, you can deny the favor. You can delegate the task to someone else. If we talk about the clinical scenario, if you were leaving for a ballet recital of your daughter and she is really waiting for you and you have everything in order, but suddenly a person who was late from this morning's appointment showed up right now, would you accept that patient? The answer to that should be, I would try to ask my associate if they can accommodate in the schedule. I will speak with the patient. If there's an emergency, can they come back tomorrow, or can they make another appointment later? Have a communication, talk with them, delegate the task to someone else if possible, but also make sure that you attend to your priorities. That if they are asking you a question one night before the exam, you are not going to miss the exam. But if you have to, if it's your parent who has a very serious condition, you will send a quick email to the instructor and let them know that I'm unable to attend the exam because of a family situation. And after the situation has resolved, you will go and communicate back with the instructor and ask them how can I make up for that test if possible. Also, you have already prepared for the exam. You have already studied all 2 or 3 months before the exam, so you are well prepared. Even if you get a little bit of sleep in the night and next morning you wake up and you are able to go give the exam, you will just give your best shot and not expect very high score, but expect that you did the job you had to do, communicate with your professor and solve the problem. And you can also add that before the exam, no matter what situation it is, you know how to do a meditation or a breathing exercise. You know how to just sit down, breathe in, let the stress pass away and answer and go into the exam with a blank mindset. You can give an example that this kind of situation did occur in past and you were able to give the exam after you did some kind of breathing exercise, some kind of meditation, how you keep yourself comfortable in a stressful situation, and how do you attend to a situation which comes in the very last minute of when you are going to do something important. So this was a quick preview of 1 out of 50 plus amazing questions in my Udemy interview prep course. The link is below in the description, and also you can book a mock interview session with me where I'll be happy to give you one-on-one feedback on each interview answer that you prepared. This is going to be a very important interview of your lifetime, especially for internationally trained dentists, foreign trained dentists who are getting interviewed in schools of North America for the DDS or DMD program. This is the perfect opportunity for you to join my course, go through all the questions, and after that, book a mock interview session with me. I'll keep posting new questions every Wednesday, so stay tuned with Teach Your Dentist. Bye.